So now maybe I have, because after 1 or 2 days, the classes will start. Because we are not going to make the class very low relative. Now, sciatica pain, these are the pain points. These are this, these are this, these are this. We are going to be very specific on the treatment protocols. We are not going to speak about the details. So if you want to know about any details, you may please talk to me right now. Because after we have the license for 300 people, maybe by today or tomorrow we'll have it. We have written them because there is some algorithm problem. Because in Zoom, often you will find certain problems are there. Because Zoom is most hijacking situation. They always hijack certain things. So they always upgrade their firewalls. And during these firewalls, when they upgrade, we always face some problems as a users. So already the money is paid. Maybe within 1 or 2 days, they will come back to us. Right? So you may ask me your questions, please. Ask me your questions, whatever you want to ask, then I'll start my class.
Good evening, sir.
Yes, tell me.
Sir, I'm Jitendra from Delhi. I have a
Yes,
patient in my family. The patient is a male, about 17 to 18 years of age, and
yes, sir.
he is suffering from epilepsy since birth.
You're suffering from?
Epilepsy, sir.
Yes.
He is not able to speak. He's always drooling.
See, this type of people have always gone through a large number of anti-epileptic drugs, right?
Yes, sir.
So to revive them is very difficult because the patients are, the guardians are the biggest drawback of recovery of the patient, because if they have a small epileptic attack while you withdraw the medicine or when you try to taper
Mm-hmm.
the medicines, they create a lot of
Mm-hmm.
havoc.
Mm-hmm.
And these anti-epileptic drugs, if they are not revived in a proper way, process is not done, then the patient life is very miserable.
Yes, sir.
So the entire system to recover the epileptic patient is very difficult because the patient is on higher medicines and recovery is very difficult.
So, sir, in that case, can we do anything?
What can you do? Now you tell me. He is already in the high dose of Tegretol or phenytoin, right?
Yes, sir. Phenytoin.
Yeah, he's already in the high dose. Now what can you do and what can I do?
Okay.
Can you withdraw phenytoin? And after
No,
you
sir.
give your treatment to the patient, right?
Mm-hmm.
After you manage the patient, and by chance the epileptic attack comes, what will the patient, the guardian will say? It is because of the treatment you have done, the attack has come, right?
Right, sir.
Not because of the problem and because the drug has become resistant.
Mm-hmm.
So in epilepsy, neither the allopathy can do anything, nor anyone can do anything. Even after taking
Okay,
the
sir.
medicines, also they have these epileptic attacks.
Yes, sir. That is the actual case he is suffering from.
Yeah. So in this type of cases, nothing much can be done. Even if you want to do anything, the biggest obstacle is their parents.
Okay, sir.
You understood?
Yes, sir.
So there are many more cases which we can do. Better to avoid two things in your life. Never try
Yes,
to
sir.
treat your relatives.
Mm.
In my life, I never treat my relatives,
Okay, sir.
nor my friends.
Okay, understood.
हेलो
Yes, tell me.
सर, मैं जायसवाल बोल रही। सर, मेरी मम्मा अभी हैदराबाद में है और उनको एक अटैक आया तो ब्रेन में मल्टीपल ब्लॉकेजेस निकले, मगर उनका
Hmm.
बीपी कम नहीं हो रहा है। तो सर, हम लोग कुछ कर सकते हैं? तो मतलब फिर मैं उनको, मतलब वो तो आईसीयू में है, वहाँ आपके यहाँ तक तो नहीं ला सकते उनको, तो
मैडम,
कुछ कर सकते?
आईसीयू का मतलब होता है क्रिटिकल केयर।
हाँ सर।
पेशेंट को जब तक उसका वाइटल स्टेबल नहीं हो जाता, उसका क्रिटिकली वो पेशेंट स्टेबल नहीं होता, until see the patient is asking that her mother is suffering from a multiple brain
ब्रेन ब्लॉकेजेस।
hemorrhages, micro hemorrhages or certain situation in the brain which we call it CVA, right? In this condition, the patient is admitted in the ICU. Patient abhi ICU में admitted है. Now she is asking me, can we do in this anything in this condition? My first advice is, since the person who is like, if you ask me to do something, yes, I can do. But the problem here is that who will treat that patient?
कैन यू गो देयर सर फॉर विजिट?
And do you think leaving this 40-bedded hospital, I can go and come in the traffic of Hyderabad?
Oh, sir, we'll ask to my brother. He is in also Hyderabad.
Madam, it is not possible for me to go and come because I
Okay, sir.
myself have my own patients. I cannot leave this place for one day also.
Okay, sir. Okay. हम्म, सर, उसमें ना आर्टरीज में मतलब आर्टरीज फटी नहीं है, हेमरेज नहीं हुआ है, सिर्फ ब्लॉकेज बन गए बहुत सारे।
हाँ, उसको क्लोटिंग बोलते हैं।
हाँ, क्लॉटिंग हो गए।
हाँ, तो थोड़े दिन में डिस्चार्ज हो जाएगी, उसके बाद ले आइएगा।
बीपी कम नहीं हो रहा ना सर, प्रॉब्लम ये कल परसों से भर्ती है रात से, बीपी कम नहीं हो रहा है।
वो थोड़े दिन में हो जाएगा। इंट्राकुलर प्रेशर बढ़ा हुआ होगा, इंट्रा सेरेब्रल प्रेशर आईसीपी बढ़ा हुआ होगा,
अच्छा।
इसके कारण बीपी कम नहीं हुआ, धीरे से कम हो
हाँ।
जाएगा।
अच्छा अच्छा। हाँ, कुछ और ना हो जाए करके मैंने बोला कि आपसे थोड़ा पूछ लो, वो हैदराबाद में ही है, तो मैंने बोला कि
अब जो होगा मैडम वो तो होता रहेगा,
हाँ, वो तो है सर।
आप और हम कुछ नहीं कर सकते।
ठीक सर, ठीक।
सर हेलो।
हाँ, यस, टेल
नमस्ते
मी।
सर।
यस, प्लीज टेल
नमस्ते
मी।
सर।
मैं नो स्पीकिंग।
हेलो सर।
बोल रहे हैं? कौन बोल रहे हैं?
शिव शंकर वर्मा सर, मुंबई से।
हाँ, शिव शंकर जी, नमस्कार, बताइए कैसे हैं? हाउ आर यू?
बढ़िया सर।
हम्म।
थैंक यू सो मच सर। पेशेंट तो आ गए वापस से, चल रहा ट्रीटमेंट उनका।
कौन सा पेशेंट?
गाला गाला।
गाला कैसा है अभी? गाला
ठीक है सर। आई
उसके
ओपनिंग
आई
तो
मूवमेंट
है।
ऐसा तो आ गए थे, अभी कैसा है सिचुएशन?
आई इम्प्रूवमेंट, आई ओपनिंग का ज्यादा हो रहा है सर अभी।
हम्म।
कल गया था विजिट के लिए, अच्छा खासा आई ओपनिंग था।
देखो, now two things you have to do in this case. Whenever the patient does eye opening, you have to teach the patient to see right and left. पेशेंट
ठीक
को
है सर।
हर चीज आपको सिखाना होगा,
श्योर
आंखों
श्योर
का
सर।
मूवमेंट से लेके मुंह खोलने से लेके
हम्म
सब कुछ। जैसे जैसे आंख खुलता है,
हम्म
you have to tell him to see right, you have to teach him to see left, because now
लेफ्ट।
patient has become totally
हम्म
जीरो। एक एक चीज अगर आप सिखाएंगे, मैं अभी सीपीएन वाला पेशेंट को मैनेज कर रहा हूँ,
हम्म
उसको मैंने चलना, हाथ का मूवमेंट, सारी स्पास्टिसिटी तोड़ के, नाउ माय पेशेंट इज 70% ओके। बट सीपीएन पेशेंट्स को रिकवर करने में थोड़ा समय लगता है।
टाइम लगेगा। ठीक है सर, बट ओवरऑल इम्प्रूवमेंट हो रहा है, ग्रेजुअली हो रहा है, बट इम्प्रूवमेंट तो हो रहा है।
मैंने ऐसा कर दिया था कि आई हैव बिल्ड द गुड फाउंडेशन, ताकि आप पीछे से संभाल सको।
थैंक यू सो मच सर।
क्योंकि मुझे आप पर विश्वास था, यू आर माय ओल्ड स्टूडेंट। तो मैंने क्या किया, इंस्टेड ऑफ रिकवरिंग द पेशेंट इन द हायर सिम्टम्स, there are two things what you can do as a physician. First is to build the foundation, and then you can hand over the patient to the other person, because you do not know the basic things what has to be done with the patient, right? The basic architecture, आपको लोग को basic architecture नहीं मालूम। हम लोगों ने क्या किया, since we know the basic architecture, We rebuilt the basic artery structure so that in my absence, for the follow-up you can do, and after certain level of recovery, again he can come so that we can recover him to a better extent.
Yeah.
इतना दूर तो आना पॉसिबल नहीं होगा, इसलिए आप आगे मैनेज कीजिए. आई एम श्योर
Sure, sure, sure.
पेशेंट बहुत अच्छे से आपके हाथ में रिकवर करेगा.
Thank you so much. See you soon, sir. I will come to
Huh?
Hyderabad, sir. I will come to Hyderabad very soon, sir. Thank you so much.
कौन बोल रहे हैं?
शिव शंकर सर.
ओ शिव शंकर. हाँ,
बोल रहा हूँ सर, हैदराबाद आऊंगा सर मैं फिर से एक बार आपके
ये
पास.
सब आप लोग का घर है साथ, मेरा तो परिवार भी नहीं है. You all are my family. So whoever wants to come here, they
जरूर
can
जरूर
come.
sir.
They can stay. As
Sure,
long
sir.
as you want to stay, you stay. As long as you want to learn, you learn. And as long
ठीक है,
as
thank
you
you, sir.
want to
Both will
learn
come
more this
together.
concept, you learn. You want to study up to night 3 o'clock also, I have no problem. You will become tired in studying. I will not become tired in teaching.
Okay, sir.
आपकी हिम्मत होनी चाहिए पढ़ने की. It is your gravity to learn, not my gravity to teach. If you want me to continue the class, this Zoom class will talk to 3 o'clock. I will
Sir,
continue.
Mr.
Pardon me?
Sir, I and Mr. Shiv Shankar will come together to meet you at
आपका
Hyderabad.
घर है, जब आना हो तब आइए. आपका घर है, आपका परिवार है, जब आना तब आइए. रहना फ्री, खाना
Sure.
फ्री,
Definitely, I
पढ़ना
will come,
फ्री.
sir. Very soon, I will come.
See, I am inspired by Master Tung. In seminar, it becomes difficult. But all of a sudden, if you want to come and study here, you can come and study. Accommodation is
Yes.
free, food is free.
Thank you, sir. I will come. Definitely, I will come.
हाँ, खाना फ्री, रहना
Thank you.
फ्री, और कुछ नहीं तो
और
हैदराबाद
क्या
तो घूमने मिलेगा.
सर? खाना फ्री, रहना फ्री और एजुकेशन फ्री, और क्या चाहिए?
You see, one thing I tell you, you people have so much struggle. You have so much deep sympathy for the patient. If I cannot teach you, what is the use of this knowledge in my life?
Not everyone thinks like you, sir. You are super, sir.
What I will do with this knowledge? This knowledge is good for nothing. If you people are not there, see, if you did not have the confidence of giving gala to me, how would I have worked with this central pontine myelinosis patient whose video I am going to put? Now he has started walking also. A patient who was bedridden for 3 years has started walking.
Great,
From
sir.
coma
Great.
to now.
Yeah, every day I'm keeping scrolling your videos only.
So you will scroll this video tomorrow and you will see that how with difficulty we are teaching him to walk, and now his hands have become okay, his spasticity has been reduced to 70%. So all these things are there, and it is a case of central pontine myelinosis. In central pontine myelinosis, because of the low sodium level, patient goes to the coma level. If the correction is not done in a proper way, then the patient may enter a vegetative stage. That means his coma may break in 3 months, 4 months. These people have referred me a patient from Mumbai. He was not opening eyes and he was sinking. But over here, we did in such a way that frequent eye opening was there, sensorium was improved, but they did not have much time in their hand, so they had to go back. Otherwise, in CPM, it takes 6 to 7 months to revive the patient. Particularly, this patient was treated in Dhirubhai Ambani Hospital, and they have paid around 70 to 80 lakh rupees. Means 7 million to 8 million currency was already spent in Dhirubhai Ambani with very high antibiotics, which was not required at that time, as per my opinion. So you may ask me more questions. Because after 1 or 2 days, the classes will start. You won't get much time to ask me questions. 3 days I have taught you about many things. Today is your day. So you have any doubts, you may ask, or I'll speak something on various aspects of pain management.
Good evening, doctor.
Please.
Good evening, sir.
give out your name. Yes, yes.
Good
Please
evening,
speak
sir.
about your
Good
name.
evening.
Yeah, yeah.
Should I
Please,
start?
please.
Can I start my question?
Definitely, madam. Most welcome. Why you should not start your question?
सर मैंने मेरे लड़की का मैंने उस दिन दिखाया ना, वो शी वाज नॉट बाय बर्थ हैविंग अ सीपी, राइट? शी मेट उनको 3 इयर्स की थी तभी चिकन पॉक्स हुआ था। उसके बाद ये जो एंटीबायोटिक्स ये जो दिया फीवर में, वो उसका इशू धीरे धीरे उसका थोड़ा सा स्लो होने लगा। अभी वॉकिंग का थोड़ा सा डिफिकल्ट हो रहा है उसको, तो उसके लिए क्या कर सकते हैं हम?
मैडम देखिए, ये सब तो स्पेशलाइज सब्जेक्ट होता है, बिकॉज यू आर वर्किंग विद 33-year-old पेशेंट, राइट?
यस।
फॉर एग्जाम्पल, न्यूरो सर्जरी बनते ही आदमी न्यूरो सर्जरी चालू नहीं कर रहे। पर्सन हु क्वालिफाइज न्यूरो सर्जरी डज नॉट स्टार्ट न्यूरो सर्जरी, ही हैज टू बी फुली स्पेशलाइज्ड इन दैट सेक्टर। तो अभी इस पेशेंट को 33-year-old माइलस्टोन्स को कवर करने के लिए, to cover up the 33-year-old milestone, you have to work typically on the patient with various aspects, and dhire 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 its milestones will be recovered, spasticity will be broken, and then the patient will be what? To a normal stage. But if you think in 5 days, 10 days, or by putting 1 point, 2
I'm
point, or
not
3 point,
expecting that. Yeah.
yeah, by putting few points, acupuncture, tung, tang, ting, tang, if you put, and the spasticity will block. No, because the spasticity is generated from the neurons, upper motor neurons.
So उसके लिए क्या कुछ मतलब और भी ज्यादा डैमेज ना होने की वजह स्टॉप कैसे कर सकते हैं उसको?
मैडम देखिए, पहले तो डिजीज का प्रोग्रेशन अगर आप अपनी तरफ से जो कर सकते हैं आप कीजिए, उसके बाद वो एक स्पेशलाइज्ड तरीके से ही किया जा सकता है।
व्हाट स्पेशलाइजेशन करेंगे मतलब?
पढ़ना पड़ेगा आपको, पढ़िए, प्लास्टिसिटी के बारे में पढ़िए, अपर मोटर न्यूरॉन्स के बारे में पढ़िए, हाउ ब्रेन कम्युनिकेट्स विद द मसल्स, वो पढ़िए, तब आपको समझ में आएगा कि आपकी कमी क्या है।
ओके।
गूगल में तो दिया, यूट्यूब में दिया हुआ है, आप पढ़िए अपर मोटर न्यूरॉन्स प्लास्टिसिटी, लोअर मोटर न्यूरॉन्स प्लास्टिसिटी। वो अगर आपको समझ में आ गया, तब आपको समझ में आएगा कि व्हाट यू हैव टू डू। यू हैव टू स्टडी द spasticity is created from the brain. So until or unless you are able to break the spasticity which occurs from the brain, how will you recover the patient?
Okay.
पहले फाउंडेशन समझिए ना चीजों का, प्रॉब्लम क्या वो तो समझिए। You are finding a solution without understanding a problem. You are seeing a problem, but you are not seeing the underlying cause of the problem. So to understand the underlying cause of the problem, you must understand the foundation of the problem, how this problem was created from birth to now, and what is this stage of recovery. Now, then you must analyze what is your knowledge. Can you work with this type of problem or not? If you cannot work with this type of problem, then specialized knowledge, specialized centers, and specialized methodologies are required. क्योंकि ये तो न्यूरल प्रॉब्लम है, दिस इज ए प्रॉब्लम फ्रॉम द न्यूरल बेसिस।
या
अब न्यूरॉन्स के बारे में आप क्या जानते हैं बताइए? न्यूरल लेवल पर आप स्पास्टिसिटी को कैसे तोड़ेंगे बताइए? तोड़ पाएंगे?
No, sir, I am too much of confused about that all. So that's why I'm asking.
That is why I am saying, madam,
Mm-hmm.
whenever you are dealing with a critical case, you need a support of a infrastructure and experts.
Okay.
Then only you can overcome the situation. Otherwise, you cannot overcome. You could not overcome this situation from last 33 years. Am I right or wrong?
Yes, sir.
Then
हम लोग आएंगे आप हैदराबाद एक बार, आपको उनको लेके आएंगे हम।
मैडम एक बार नहीं, कुछ समय लेके आएंगे तो काम होगा। ऐसे तो
समय
ऐसे देख लिया, मैंने देख लिया, आपने देख लिया, मैंने आपको समझा दिया, क्या हो जाएगा बताइए? Until the patient is treated, what can we do? You are asking a doctor. A doctor has gone to a party, right? He has no medicine, nothing, and you are asking him to treat the patient. What will he do?
करेक्ट.
Am I
हम लोग
right or wrong, madam?
समय लेके आएंगे. We'll get the time.
समय लेके आइए. We have to treat the patient. उस दौरान आप भी देखेंगे कैसे कैसे रिकवर होता है, किस तरह से दवाएं दी जाती है, किस तरह से स्पष्टता तोड़ी जाती है without giving botox, how normal saline and small combination of different medication helps you to break the spasticity. और उसके बाद स्पष्टिसिटी होने के बाद कैसे फिजियोथेरेपी से उसको और ब्रेन के साथ ट्यूनिंग किया जाता है, इट इज कॉल्ड द फाइन ट्यूनिंग विद द ब्रेन. ऑल दिस हैज टू बी डन. अब वो चीज करेंगे तो ही पेशेंट रिवाइव हो पाएगा.
Sure, doctor. Sure. Thank you so much.
थैंक यू मैडम. You may ask me more questions, please. Clarify your doubts. You have to come openly because we are learning a medical subject. Tell me. Ask me questions, please. See, after 2 days, you won't get the chance to ask me questions. So whatever
Sir,
questions you have,
Jitain,
doubts you have, you please ask me right now.
sir, this side Jitendra again from Delhi.
Who's asking me question, please?
Sir, Jitendra.
Yes, Ms. Sabji, please ask me your questions.
Sir, is it possible that we can revive a case of alopecia?
Alopecia. See, alopecia have not worked. I am a man of neuro, brain and spine diseases with neuromuscular disorders, hemangiocytis and all.
Ji.
So this subject is not of mine. I'm not a skin specialist.
Okay, sir.
So if I'm not I can give you a small idea. Cut off the hair and put a wig. Beautiful wigs are there in the market. You look much beautiful.
Any type of sciatica pain and
No need to spend any money.
also
Just spend
involved
7,000 rupees.
sciatica pain.
Buy a beautiful wig. You look more handsome.
Also involved.
No, if I'm not asking for me, I have complete hair on my head.
I'm giving a beautiful idea. Instead of spending so much money in hair transplant and all, give a beautiful cut to the hair. Give a nice wig. These days I'm seeing very beautiful wigs are coming. Putting a haircut and it will make you a young, handsome boy. Within 5,000 rupees, 6,000 rupees, your hair is done. Alopecia is gone. You become a young gentleman. No need to spend so much money in getting back your hair. Indian shortcut method.
Okay, sir.
Sometimes we should go for shortcut methods.
Sir.
Sir, Maharabin.
Okay, all right. Ask my ma'am.
Okay. So long back, I used to have a lot of pain in the soles of my feet and my heels, and the doctors had said it was plantar fasciitis. But I don't know how it went away. But now my neighbor is complaining of the same thing. So
Madam, in plantar fasciitis, 3 things has to be taken care. One is of the soles. It is called a repeated injury. The bone calcaneal spur is increased in the plantar area, which creates the inflammation. So first thing is the repeated injury. So at home, the patient should not walk barefooted. He should wear doctor's scroll Write down Dr. Scroll or Aerosoft Sleeper. What is that? Aerosoft and Dr.
Microsoft.
Scroll. If they uses this type of sleeper and also a silicone heel,
Uh-huh.
regular use of silicone heel, non-repetitive injury may recover the patient.
Okay. So there's no treatment as such for that.
Madam, treatment is there. I will take what? 2 minutes to revive this patient. But how will you revive this patient? 2,
So
3
is it
minutes I will take.
is it
I will
because
do some
of,
acupuncture anesthesia and then I will introduce some normal saline inside, deep inside, and then the patient is what? Tuck. But if you put directly, there will be severe pain. People will run away immediately. Without inserting the injection, people will run away. So acupuncture anesthesia is used to reduce the pain. And then if you use this normal saline injection, plantar fasciitis goes in 1 or 2 sessions.
thank you, sir.
Sir, hello, sir.
Tell me, sir.
Yeah, if a patient is diabetic patient and
Hmm.
the patient is having Charcot foot arthropathy.
Hmm.
So can we do something for him?
Definitely, we
Aged
can do
patient,
Charcot
60
arthropathy
or
also.
65 around age.
Now you have to see what we can do. What is the position and what we can do, because we cannot predict what can be done right now until the patient is in my hand and what will be best remedy for the patient.
Okay. So, okay. Right.
Hmm.
Tell
सर
me.
आप साइटिका के बारे में बताएंगे सर?
साइटिका के बारे में तो विस्तार से वो डिस्कशन होगा ना ट्रीटमेंट प्रोटोकॉल में. अभी तो हम लोग ट्रीटमेंट का प्रोटोकॉल चालू नहीं किया क्योंकि 300 का लाइसेंस नहीं मिला. वी डिड नॉट गेट द लाइसेंस फॉर 300 people. Sometimes what happened that after paying the money in their algorithm and in there some problem, we are struck off. Right? So the
सर
company is trying to resolve our problem. The moment we get 300, we'll write you all the protocols and we'll explain you in details. Meanwhile, I thought that till we get the 300 license, whatever doubts and closeness, because the first thing between a teacher and the student is the rapport building. So I thought that we'll have some introduction to each other. Right?
Yes, sir. Yes.
Because medical knowledge is an infinite knowledge, right? So if we spend some time extra with each other, I don't think so there is any loss. If we spend 1 hour or 1.5 hours each other, I don't think so there is any loss among each other. But it will be a gain to your knowledge, which will help you to recover the patient in further diagnosis and treatment and understanding of a disease. Right?
But sir, I want to ask something. There is a pain originating from caudal bone, above caudal bone, S3 or S4, and radiating towards lateral side. Is it sciatica, sir?
No, madam. Sciatica pain comes from the L4, L5, L5, S1 region. L3, L4 region always goes to the lateral side.
अच्छा,
Sciatic nerve originates from L4, L5 region.
अच्छा। तो फिर
But
इसके लिए
when L3,
इसके
L4 is having a pain, there might be a spasm in the muscles which may be compressing the nerve roots. As a result, the sciatica pain may occur.
ओके ओके सर।
Am I clear?
हाँ, तो ये पेन किस कारण होगा सर फिर ऐसा?
Madam, actually L3, L4 में she's asking me why the patient is having sciatica pain, but the pain originates at L3, L4. See, I am explaining her in Hindi. L3, L4 में पेन होने से स्पाजम आता है. स्पाजम यानी मसल कंप्रेशन. Because of muscle compression, nerve roots पे pressure आता है. If there is a pressure in the nerve roots, the pain reduces to the lower limb, and it becomes sciatica pain. So the spasm and that area of L3, L4 is recovered, the pain will reduce to a greater extent. Am I right?
Sir, is that spasm called paraspinal spasm?
You are right. It is called paraspinal spasm. Any type of slip disc may lead to paraspinal spasm.
तो ये पेन जो मैं बता रही हूँ सर, ये ओबेसिटी के कारण हो सकता है?
मैडम, ये पेन तो एक आखी हो गया पेन. लो भाई, हो गया बर्थडे.
इलियम का जो क्रिस्ट है ना, उसके अलोंग हो रहा है, मतलब पेन है सर.
मैडम, ये देखना होगा झमेला क्या है. इट मे बी समटाइम्स बिकॉज ऑफ द ट्रिगर पॉइंट्स, sometimes because of the paraspinal muscles, because sometimes of the sitting
और
posture.
हाइपर एट्रोफी होती है तो क्या करेंगे सर? हाइपर
अब
एट्रोफी होती है
hypertrophy होती है तो भी उस एरिया को तो इन्फ्लेमेशन को रिड्यूस तो करना ही होगा ना, by using drying needles and other activities.
एक्चुअली मुझे ही हो रहा है सर, ये करके पूछ रही हूँ.
आपको हो रहा है मैडम, मैं कुछ प्रोटोकॉल लिखवा दूंगा, आप ट्राई करके देख लो. सही होता है तो सर्टिफिकेट दे देना मुझे कि सर आपकी तरीके से ठीक होता है.
आपको क्या सर्टिफिकेट की आवश्यकता है?
आप लोग ही देते हैं मैडम सर्टिफिकेट. यू गिव मी द मोस्ट डिफिकल्ट केस टू रिकवर. आपने सुना नहीं, मिस्टर गाला he has given me a patient who has not been treated in Dhirubhai Ambani Hospital, best hospital of India. After spending 1 crore rupees, he has sent that patient for me to recover that patient from coma stage. So who's my examiner?
पेशेंट.
I'm my examiner or you are my examiner? Tell me.
नहीं, बराबर है सर, बराबर है आपकी बात.
वो भी कोमा का पेशेंट, इतना कम इंफ्रास्ट्रक्चर में उसको मैनेज करना. अगर कल को कुछ हो जाता तो उसकी तो बदनामी होती. कितना बदनाम हो जाता सिचुएशन और सिम्टम्स. पूरा एक्यूपंक्चर बदनाम हो जाता, पेपर में नाम आ जाता. और मैं तो अभी तक बड़े घर का खाना खाता.
सर जो कोमा का पेशेंट आप बता रहे हैं, वो ब्रेन डेड था क्या?
सेंट्रल पोंटिन माइलोनोसिस, CPM.
ओके. एक्चुअली एक केस है
ये
यहाँ पे
हाइपोमेट्रेमिया के कारण हुआ.
ब्रेन डेड केस है जो ब्रीच कैंडी हॉस्पिटल से है, मुंबई. उस केस में कुछ हो सकता है?
पेशेंट का आईसीयू में है ना घर पे?
घर पे आईसीयू सेटअप, पूरा मोबाइल आईसीयू.
आप बस पेशेंट को श्री राम जी के भरोसे छोड़ दो.
Okay. Yeah, he's having since last 4 months around.
अब उसको यहाँ तो आप शिफ्ट
Same
नहीं कर सकते हैं. आप उसका कुछ नहीं
same
कर सकते
condition.
हैं, मैं कुछ नहीं कर सकता. तो कौन कर सकता है? राम जी. तो राम जी के भरोसे छोड़ दो.
रब रखा. सही है सर. भगवान धनी, राम धनी.
हमारे नहीं.
Sir, I have this numbness in my right side, femoral muscle. It's
So we will give you
when I
some
stand for
protocols
a
by
long
which
time. Huh?
during the treatment, when I will be taking the treatment illustration, you will get number of protocols for this numbness, these, by which you can recover and you can get a better recovery.
Okay, sir.
Take a
Because it's
notebook,
always
write it, and if you forget anything, you go for the recordings and you will find out this one. 1 or 2 class we have kept ourselves. till we get the licenses, we'll have the chance to interact with each other. Interaction is the most important part so that I can understand what you know, what you want to know, what are the basic problems you are facing. While teaching you, I can encounter all these basic problems because in 6 hours, we'll be able to say you so many things. But I must know what I have to speak. I speak so many things which is not relevant to you. What is the use of this class and knowledge? So first of all, I must know what you want to know.
Right. Yes, sir.
And that I cannot know. See, if I speak, I'll speak at PhD level and you do not know the preliminary level. So I must know what you want to know. Once I know what you want to know, it becomes easy for me to teach you and revive you. Help you to increase your knowledge. Right?
That's right. That's right.
3,000 rupees is not important for me. You want the refund? I give you immediate refund. But before going without a basic foundation, and Zoom has given us the opportunity to go for this foundation. So we must understand and proceed in a proper way so that when we do practice, we don't question ourselves. We are not surrounded by a lot of doubts in our mind and we lose our game.
Yes, sir.
Sir, good afternoon, sir.
Yes. Walid, please hear what she is saying. I'm not familiar to you. Nigerian language. Walid,
Yes,
My name is
Sastry.
Kasin Olaleko.
you hear what she is saying.
Okay.
Okay, sir, Dr. Walid, please, I want to ask doctor, how do we go about pre-mapping for a CP patient?
How do we go about?
Brain mapping for a CP child.
How do you go about brain mapping for a CP child?
Yes, sir.
It's patient
You
per
are
patient.
asking me those questions for which you need a practical training. In 1 hour, 2 hours, you know what is CP? 1 minute, you ask her one question. What do you mean by CP?
You can hear
ask
him,
them
but
one question.
Takina,
What is the meaning of CP?
he is
Sir,
asking, what do you
sir.
understand by CP? Go ahead.
So, in a situation whereby one part of the brain is not well developed in a child.
No. What do you mean by CP? One word.
Okay. Abnormal brain
sentence.
development. I don't know.
You are asking me to teach you about paralysis of CP child. But if you don't know the foundation of the subject, how will you treat this patient?
I said CP is a situation whereby one part of the brain is not well developed.
No, madam. CP means cerebral palsy.
Sir,
Cerebral palsy
I've
means,
said that already, sir.
1 minute, madam. Cerebral
Okay,
palsy
sir.
is defined as paralysis of the brain. It is a static condition. What it is? It is a static condition. So to break this static condition, you must know various methods, protocols by which you can develop the brain.
Okay, sir. Thank you.
In our next course, we'll be teaching you much about paralysis, different types of paralysis, diagnosis, so that your knowledge becomes a very good knowledge and you are not after MK Sastry said, we can recover this patient, we cannot recover this patient. See, if you have a knowledge, you can do a lot of things.
Okay, sir. Thank you, sir.
Thank you, madam. Ask questions.
Sir.
Sir.
Hello.
Sir, namaste, sir. Hello. Sir,
चले गए जय हो
hello.
Hello.
Tell
Hello,
me,
sir.
please. Yes,
Sir,
tell
I'm
me.
from Hyderabad, sir.
Yeah, tell
Sir,
me.
one patient is having some BPH, sir.
What is the patient having?
BPH, benign prostate hyperplasia. So is it curable or is it a surgical treatment? Can we do in,
I think it's a
in our,
surgical treatment. It's a surgical treatment.
better to go for surgical, sir.
Yeah. What is the size of the tumor?
30, sir. 30 or 35.
Is the size increasing and the patient is finding some discomfort?
Yes, sir. Dribbling urine, he is getting dribbling urine. When the bladder is full, in the early morning when the bladder is full, it's not getting urine, it's getting dribbling.
Some better surgery is the best option. Go to a good urologist and get it operated. Is the best way.
In this method, we cannot do the treatment, sir, in acupuncture.
Sir, you are treating a patient who is in the last stage of the disease. In terminal stages, you have to recover the symptoms or you have to prove our efficacy. Case if it's a neurological case, pain management, all these things we can work out. But in this type of urological cases, it is very difficult. How will the brain reduce the size of the tumor?
Yes, sir.
Is it possible to reduce the embolize? Are we capable to embolize the tumor? See, we have done in our infrastructure because we have a sufficient infrastructure when we work in a medical college like KIMS and Karat. Because we can go for investigation. If there's any problem, a team of surgeon is there to manage the case. But in your place, who will manage this patient? So better why to take risk? You have so many patients. One patient, if you don't take the risk, what will happen? Right? More questions?
Which meridian is also.
You may please ask me a questions because after some time you won't get the chance to ask me questions. And by answering your question, at least I can say that, yes, I am capable, I am a learned person or I know something about the subject. Otherwise, if I don't answer your question and answers, and I keep repeating the slides, people will think I am just speaking in air. So you can test me with your knowledge. You can test my
Sir,
knowledge.
what is
I
about
give you open opportunity to
sir?
test you my knowledge.
Hello, hello,
Tell me,
sir.
please.
What is about importance and erectile dysfunction?
Oh, I am an unmarried person, so I don't deal with that question.
But inquiries are there.
Yeah, they are there, but
It's common now.
it is a common question, but I don't deal with these sexual problems because that is not the subject of my interest. The subject
No,
of
it
my
is
interest is
one type of neuropathy. No, this is one type of neuropathy. No.
it is type of neuropathy, but generally this type of patients do not approach us, and so we don't have much experience in dealing with this type of cases.
Okay, thank you, sir.
I can only speak about to you about those cases which comes to me, like MND, ankylosing spondylitis. There are a large number of diseases which come to us, but this type of patients, they do not come to us because I am not famous for dealing with what
Sir,
erectile
autism.
impotency or something. As people know, I am not married, so people don't come to me. These questions answers can be given by a married person. I think Amit Kapoor will be the right person to answer you this question. Those who have 3 children, 4 children, and Maruti Patil, you will be the best person to answer this question. You might be having 2, 3 children. So you may be able to answer this question more nicely than me.
Or
I am a bachelor.
sir,
No, sir. This is neuropathic
Huh?
condition. No. That's why common we have many inquiries for that. That's why I was asking.
Anyway, I was just joking. I'll give you a proper answer
Okay.
during the treatment protocol. I was just making a fun of.
Okay. Thank you. Thank you. Thank you. Thank you.
हाँ प्रकाश जी
वो पार्टी दर्शन का भी क्लास चल रहा है, तो उसमें भी कई स्टूडेंट है। अगर किसी क्वेश्चन आंसर नहीं है तो क्लास समाप्त किया जाए।
नहीं, क्वेश्चन आंसर्स हैं, अभी भी लोग सवाल पूछ रहे हैं।
अच्छा,
Let them continue the questions.
क्वेश्चन के लिए बात करो ना सब।
उन्होंने मुझे एक सवाल पूछा था, तो मैंने उनका एक ऐसे जवाब दे दिया। एक्चुअली ये न्यूरोपैथी में आता है, ये इट इज अ टिपिकल केस ऑफ न्यूरोपैथी. So see, in 5-year-old, I'll give you the treatment protocol. It is very easy to recover facial palsy. Facial palsy, you can see in my Facebook also. I have recovered a facial palsy in 10 days. So patient was not able to move his eyes, nerve, and all. We were advised to go for eye surgery, but with the help of needles, within 10-12 session, patient totally recovered. The evidence is on my Facebook.
हेलो सर.
Yes, tell me.
सर मेरी पहचान की एक आंटी है, तो उन्होंने 3 years back she fell down in the bathroom and she get hurt some lumbar area, so now she is on bedridden.
Is she able to move her lower limbs?
No, not at lower
This
limb
is called
also.
it is called spinal cord injury. If there is no fracture, then it is called spinal cord injury. There are main 3 symptoms in spinal cord injury: no movements in the lower limbs, neurogenic bladder, means there is no control on bowel and bladder,
Yes, right.
and more important thing is that patient cannot move his lower limbs for his whole life. So if it is treated properly and in a constant manner. Arun Lingapal, see, there is someone who is speaking too much. Arun, mute your mic.
Please. Yes.
So if this has to be treated in a proper way with regular stem cell therapy, regular this, patient can recover in a better way.
Even she can't move her hands also. She cannot turn right and left side.
Then I think it is cervical cord injury.
Yes. Okay.
So cervical cord injury, this is a patient having quadriplegia. In quadriplegic conditions, we have to be very careful. First thing is that you have to give a air bed to the patient. Air bed you have to give so that there is no bed sore. Continuous movement right and left has to be done. Stockings has to be given so there is no embolism in the leg. No clotting of the lower limbs has to be there. Because if there is embolism in the leg, and if you move the patient or you do an exercise, embolism may break and it may damage the heart or the brain and the patient may collapse. 60% of the patient of spinal cord injury or paralysis, they die because they are on bed. And constantly, if they are on bed, there is an embolism. Embolism means clotting.
Okay.
So if there is a clotting, then you may have a problem. So this type of patients are given blood thinners like ecosprin or aspirin and all. They are given. And stockings are advised.
Okay.
And then they have to be treated properly. If you are interested, you can bring the patient to Hyderabad. We have recently treated an international gymnastics who was treated in Dhirubhai Ambani Hospital. And we have been able to recover his upper limbs in a very nice way. And lower limbs also, a significant achievement was done.
Okay, thank you, doctor. I'll tell her to go to Hyderabad and meet you. And she's on Proxima, Pregaba, and Stopless.
Yes, madam. Pregabalin and all these things are given.
Yeah. Supracal, ये सब ले रही है.
Yeah, madam. Yes, these are the standard medicines which are prescribed to a quadriplegic patient.
Okay.
Nothing to worry about this. The patients can be treated in a proper way Let us work for the and think for the recovery of the patient. The more the time goes away, it will become very difficult for the patient to recover. And neural communication, muscle to muscle neural communication will become very difficult for the patient to achieve. And if when the patient is achieved, it will become like this.
Okay.
So the sooner we try to achieve the patient, the better it is. And otherwise, if the patient remains lifelong in the bed, what is the use of that life?
Yes, sure.
So we must think positively how we can recover this patient in a proper way and a better way.
Is acupuncture can with the help? Is it helpful?
And not only acupuncture gives very small recovery. You have to include in various other pathies to recover the patient, especially stem cell therapy. Stem cell therapy has to be regularly given the stems and then the nerve roots. Then neuroacupuncture has to be done. Non-invasive brain stimulation has to be done. IV stem cell therapy has to be done. Aggressive neurophysiotherapy has to be done. So all these things if done together, then we may get an effort to recover the patient. First, the patient has to sit independently without support. Then slowly the hand movement has to come. Then gradually further hand movements have to come. Then the patient has to stand on the pedal bar without the braces. Then the knee locking has to be started. And then the patient has to walk with mild support and then independent support with the help of the stick. These are the stages of recovery of the patient.
Yes.
Dr. Suhas, please mute your mic. A lot of background voice is there.
Sir,
Tell me, sir.
सर tinnitus के लिए कुछ कर सकते हैं?
Tinnitus is a very difficult subject to recover. Yet, I'll give you some points in which you can help in recovery of the support the treatment of the tinnitus. Otherwise, tinnitus is such a disease which is found to be difficult to recover.
Difficult, but not impossible, right, sir?
See, in allopathy, we always say difficult. We never say impossible.
So you are an allopathic or what?
I will always say it is difficult. I will never say it is impossible. Who knows? Any person in the world can recover it. Why should I coin a word called impossible? Why should I break the heart of the person? Why should I discourage him?
Right.
My work is to always encourage. My work is not to discourage the patient. If I discourage the patient and I say, even in the last breath of the patient, I say, now there is a Parkinson's patient who will die. There are 2 patients who are about to die in our center. But from last 5 times I have survived their life. They are about to die. I brought them back. Their family members also said, sir, aap chhod dijiye. They told me, leave it. I said, no, I will not leave it. After he comes back to life, you take home and then you can do whatever you like. But till he is in my care, I will not allow. And the patient is still alive. He is in the terminal stage of MND, but he is still eating food. He is still communicating. And I'm sure he will live more 3, 4, 5 months. Because I know once the person is dead, he's totally dead. So still he is with us. We have to work with that patient.
Sir, would you? Hello.
Yes.
Sir, will you tell me about Parkinson protocol?
Brother, Parkinson protocol will not come under pain management. Parkinson protocol is a very different protocol. First of all, we have to understand which kind of Parkinson it is. It is Parkinson's, in which dopamine is not generated. Then comes the Parkinson's plus, in which dopamine is generated but not transferred. One is idiopathic cause of Parkinson, in which we do not know what is the real cause of Parkinson. One is drug-induced Parkinson, which is because of the drug which the patient is taking for a long term, which has caused him Parkinson. Number 1. Then the grading has to be done. Grade 1, grade 2, grade 3, grade 4. Number 5, what are the one simple line of protocol do not recover this type of patient. Yet I will give you some symptoms by which his symptoms may reveal because that part we will teach you in neurology. In 5 days, pain management, Parkinson cannot come. But yet, I'll give you some protocols in which you may sustain the, you may bring some recovery of the Parkinson patient in discussion. But you must be specific which kind of Parkinson is suffering from. Parkinson's plus, idiopathic, drug-induced, right?
All right. Sir, patient is taking 5 times in a day medicine, dopamine.
Yeah. See, Syndopa can be taken 6 times also,
Syndopa,
7
yeah,
times
yeah,
also.
Syndopa.
Yeah. Syndopa starts with 75 milligram, but as the country, because Syndopa is not the medicine which recovers the disease. It is only to maintain
yes,
the
sir.
drug. But as the
Yes.
disease progresses, the dose also progresses. And then the patient enters in the stage of Parkinson's chorea. You will have the patient like this, right? And then gradually the body becomes stiff and he loses the voice, and weight loss is one of the most important part. And then the patient becomes lack of consciousness. So it
This
is called
patient is getting
cerebral atrophy.
putting weight.
Yeah, he may be putting weight, but it is called cerebral atrophy. Now, in this
Atrophy.
condition, when the patient is putting weight, you must control his diet. Otherwise, if it becomes very
Yeah.
heavy, it will become very difficult for you to
Yeah,
manage the
stomach
patient.
his stomach is increasing actually, sir. His stomach
You
is
must
increasing, getting
try to control his diet. And also, please go for his thyroid profile test and lipid profile. The 2 tests are important. What are they? Lipid profile test and thyroid profile test. T3, T4, TSH. Fasting. FT3, FT4, TSH, right?
right, sir, right. And lipid
Because
profile.
of the thyroid, TSH, yeah, TSH also, obesity may increase. Then go for the lipid profile and go for the diet restriction.
Okay, sir.
सर
More questions,
बीपीपीवी
please.
सर बीपीपीवी किस कारण से होता है सर?
क्या चीज?
बीपीपीवी बिनाइन पैराक्सिस्मल पोजिशनल वर्टिगो.
क्या बोल रहे, मैं नहीं समझ पा रहा.
हेलो सर.
बीपीपीवी पोजिशनल वर्टिगो होता है सर, वो किस कारण होता है?
अरे इतने लंबे टर्म है, मुझे एक बार देखने दीजिए क्या बोल रहे हैं. क्या बोल रहे हैं आप?
बीपीपीवी एक पोजिशनल वर्टिगो होता है. हाँ, बीपीपीवी बिनाइन पैराक्सिस्मल पोजिशनल वर्टिगो होता है, जिसमें करवट बदलने पे या फिर अचानक ही चक्कर आ जाते हैं.
ओ बीपीपीवी.
हाँ हाँ
बॉम्बे पंजाब वर्टिगो.
हाँ हाँ.
हाँ, मेरे को कुछ और सुनाई दे रहा था.
अच्छा अच्छा. तो ये क्यों होता है सर, और अपन इससे एक्यूपंक्चर से ट्रीट कर सकते हैं क्या इसको?
मैडम, ये डिपेंड करता है कि आप किस अप्रोच के साथ ये ट्रीट करते हैं. बेसिकली ये इतना ट्रीटेबल डिजीज नहीं है.
अच्छा, नहीं वैसा तो जनरली मेरे ख्याल से कुछ हफ्तों में अपने आप ही ठीक हो जाता है वो, मगर फिर भी अपने पास अगर ऐसा पेशेंट आता है तो क्या हम ट्रीट कर सकते हैं या क्या करना चाहिए?
मैडम, ये डिपेंड करता है. जनरली ये क्या सर्वाइकल रीजन से ओकर होता है, कितना बार स्ट्रेस रीजन से ओकर होता है, कितना बार इडियोपैथिक रीजन से ओकर होता है, तब तक बीमारी का कारण नहीं. यू आर सीइंग मी अबाउट ए सिम्टम ऑफ ए डिजीज, राइट? आप एक बीमारी का सिम्टम बता रहे हैं, ये किस कारण से हुआ ये तो नहीं मालूम ना हमें.
नहीं,
जिसके कारण उसकी उत्पत्ति हुई है वही नहीं मालूम, तो उसका इलाज कैसे करेंगे आप बताइए.
कई बार ऐसा मतलब बाकी हम इसमें जो पढ़ते हैं तो उसमें ये बताता है कि नाक कान अपने इनका अगर बैलेंस में कुछ क्या कैल्शियम के ये रहते ना कान के अंदर, तो वो
मैडम वो देखिए, ईयर इम्बैलेंस में आता है, वर्टाइगो में भी आता है, ईयरिंग इम्बैलेंस में भी आता है. बट किसी भी बात को मेडिकली अगर हम बात करते हैं, इफ यू आर टॉकिंग समथिंग इन मेडिकल टर्म्स, राइट, हम लोगों को
हाँ
एक स्पेसिफिक बात करनी पड़ती है, राइट, कि ये क्यों हुआ है, जिस कारण से हुआ है उस कारण से उसका इलाज कर सकते हैं। वो कारण हमारे बस में और हमारे समझ में आता है तो ठीक है, नहीं आता तो सामने वाले को पकड़ा दो, दूसरे डॉक्टर को जिसको समझ में आता वो उसका इलाज कर दे।
पर इसका तो ऐसा बेसिकली कारण तो इसमें भी नहीं बता, मतलब पर्टिकुलर कारण मालूम नहीं है ना, तो वही
मैडम
डिसीज तो
पूरा
है।
पेशेंट का एक बार हिस्ट्री देखा जाता है। देखिए मैंने कल भी आपको बताया था, किसी चीज को कंक्लूड करने से पहले फर्स्ट यू सी द क्लिनिकल हिस्ट्री, then you must understand the progress of the disease, and then you must understand how it has occurred, and then fourth you must study the anatomy of the ears and anatomy of the disease, and then you may conclude with the research papers, oh this may be the reason. Now you are in a position to recover this disease or not in a position, you may decide yourself. किताबों में टीसीएम में सब में इसके बारे में कुछ भी नहीं लिखा है, ये तो एक अनुभव होता है जिसके कारण हम इसको ट्रीट कर सकते हैं। ऐसे काफी सारे पेशेंट्स ट्रीट किए, पर हर पेशेंट का कारण अलग था, ट्रीटमेंट का तरीका अलग था और रिकवरी का लेवल अलग था।
अच्छा
कोई
अगर
भी चीज सेम नहीं होती मैडम, किसी भी चीज को करने के लिए समझना पड़ता है, गहराई से समझेंगे, तरीके से समझेंगे तो ही समझ में आएगा। सुपरफिशियली समझने से ये तो कंपाउंडर हो गया, दवाई लिख के दे दी आपने, दवाई दे दी, दिन में 2 बार खा लो 3 बार खा लो, इसमें तो आपकी क्या नॉलेज बढ़ी बताइए।
हाँ नहीं, वही तो करके तो कॉज पूछा ना सर मैंने आपको कि क्यों होता है
कोज
करके
मुझे
कि
कैसे पता चलेगा जब तक उसकी हिस्ट्री के बारे में नहीं पता चले। पेशेंट के बाद साथ बैठेंगे, समझेंगे, उसकी बातों को समझेंगे तो ही तो समझ में आएगा। ऐसे तो 1000
एक
कारण हो सकते हैं सब बीमारियों के।
एक बार तो ऐसा हुआ सर कि नरम तकिया लेके सोने से भी हो गया है, तो वो 4 दिन 5 दिन के बाद अपने आप ठीक भी हो गया फिर
मैडम
उसमें।
पहले चीजों को समझना पड़ता है, आप जो बता रहे हो वो सिम्टम्स हैं,
हम्म
यू आर नॉट टेलिंग मी अबाउट द डिजीज, you are saying me a symptom of the diagnosis. This is not the
हाँ
diagnosis.
नहीं नहीं, जैसी सर पोजीशन बदलते, करवट बदलते हैं ना, तो अचानक ही
मैडम आप
चक्कर।
करवट बदलते हैं उसको चक्कर आता है, आप मुझे
हाँ
बता सकते हैं ये इसके शरीर में ऐसा क्या हुआ जिसके कारण ये हुआ है?
हाँ, वही तो नहीं पता ना सर, करके तो आपको पूछा।
तो मुझे भी कैसे पता चलेगा जब तक मैं उसकी इन्वेस्टिगेशन, उसकी हिस्ट्री नहीं समझू। बिना हिस्ट्री समझे, बिना पेशेंट के बारे में समझे, बिना कुछ समझे मैं आपको हवा में कुछ भी बता दूं, वो सही होगा ना, मेडिकल नेग्लिजेंस होगा। किसी भी चीज को समझने से पहले उसकी क्लिनिकल हिस्ट्री, मैंने कल आपको नोट्स लिखाया था ना, क्लिनिकल हिस्ट्री, पेशेंट की क्लिनिकल हिस्ट्री समझना पड़ता है, कैसे हुआ, क्यों हुआ, कहीं ना कहीं कुछ तो कारण हुआ होगा, बिना कारण के तो कुछ नहीं हो सकता।
अभी एक पेशेंट था, उसको गाड़ी चलाते चलाते अचानक ही बस घूम गया, घूमने वाले परमानेंट नहीं रहता है, बस घूम जाता है, फिर ये नॉर्मल हो गया। ऐसा 2-4 बार हुआ, तो वो
मैडम ये एपिलेप्सी में भी आ सकता है, जिसमें भी ये एपिलेप्टिक सिम्टम ऑल्सो।
अच्छा
तो इसलिए किसी भी चीज को 2 सिम्टम के ऊपर बेस करके जो आप बता रहे हो वो एक सिम्टम है। सिम्टम मतलब समझे ना, दिस इज ए
हाँ
सिम्टम नॉट ए डिजीज। अब ये किस कारण से हुआ है, डायग्नोसिस तो हो गई, पर इसका कारण क्या है? सिम्टम इज अ डायग्नोसिस ऑफ ए डिजीज, हाउ दिस डिजीज इज ओकर्ड वो एक बार समझना होता है, और उस कारण से उसको रिवाइव करना पड़ता है। क्या पता घर बॉडी में कुछ विटामिन डेफिशिएंसी हो, पोस्चरल प्रॉब्लम हो, कुछ प्रॉब्लम हो, उसको उस तरह से देख के उसको रिवाइव किया जाता है। अब तो सिम्टम्स बता रहे, सारे सिम्टम्स हैं, ये तो डिजीज किस लिए हुआ है, ये बीमारी किस लिए हुई, ये तो आप नहीं बता पा रहे, मुझे बता पा रहे
हाँ,
हैं?
तो वो कुछ ही दिन रहती है, 2, 4, 8 दिन,
मैडम
15 दिन।
आपकी एक बात समझिए, वो कुछ दिन रहती है तो क्यों रहती है?
हाँ तो वही नहीं समझ में आया ना सर।
हाँ तो मैडम उसी को तो डायग्नोसिस बोलते हैं, उसी को तो डिटेल इन्वेस्टिगेशन बोलते हैं, उसी के लिए तो आप दूसरे डॉक्टर को रेफर करते हैं, उसी के लिए तो इन्वेस्टिगेशन किया जाता है कि प्रॉब्लम क्यों है, किस लिए है, और उसको वहां से किस तरह से हटाया जा सकता है या हटाया नहीं जा सकता है। और में तो हम कुछ भी नहीं बोल सकते हैं। आपने एक सिम्टम बता दिया कि उसको चक्कर आता है, उसका इलाज बता दो।
नहीं, ये अपन कर सकते हैं क्या? ऐसा कुछ इलाज नहीं पूछा मैंने। कर
मैडम
सकते
इलाज का आप कर सकते हैं या नहीं कर सकते वो तो सेकेंडरी बात है। सबसे पहली बात है कि पेशेंट को प्रॉब्लम क्यों हुआ है। फर्स्ट ऑफ ऑल तो एक MRI देखिए कि ये स्टार्टिंग डिजीज है, क्या सिम्टम है। एक न्यूरोलॉजिस्ट को रेफर कीजिए, वो आपको मदद करेगा समझने के लिए कि क्या प्रॉब्लम है क्या नहीं है।
ये तो 5-6 साल पहले हुआ सर। पेशेंट नॉर्मल है अभी, कुछ भी उसके बाद नहीं हुआ उसको। पेशेंट अभी
जब
मेरे
कुछ नहीं
सामने
हुआ,
बैठे हैं।
जब कुछ नहीं हुआ तो टॉपिक खत्म हो गई, चैप्टर हो गया।
सर सर
हाँ
अब गुड नाइट बोलने का टाइम हो गया।
हाँ, गुड नाइट बोलने का टाइम हो गया। 5-7 मिनट ले लीजिए, मेरा भी मन दूसरा हो जाएगा प्रकाश जी।
आपकी भी
सारे
लिमिट
दिन
है
मैं
सर।
इस
आप
बिल्डिंग में खाली
आपकी
बीमारी
भी
बीमारी
लिमिट
सुनते
है।
रहता हूँ।
आपकी भी लिमिट है, आपको भी विश्राम चाहिए, है ना?
नहीं वो तो ठीक है, सारे दिन मैं इस बिल्डिंग में खाली बीमारी बीमारी सुनते रहता हूँ।
हाँ।
थोड़ी बहुत इन लोगों से बातचीत हो जाती है तो मन दूसरा हो जाता है।
कोई नहीं, फिर भी लिमिट ठीक होती है सर।
हाँ चलिए ठीक है, 5 मिनट में खत्म कर देंगे और तो क्या, 5 मिनट दे दीजिए।
सर आपकी
Any more?
तबीयत कैसी है?
सर हेलो
हाँ प्लीज टेल मी।
सर, ग्रेड 2 एवियन में पेन कम कर सकते हैं सर?
हाँ मेरे पास है grade 2 avian. He was advised 20 lakh rupees surgery in Yashoda hospital. He has survived by 80%. Tomorrow I'll put his video.
Okay sir, thank you.
Patient is a year only. You can revive this type of patient.
Okay sir.
And grade 3 avian?
So once the patient has recovered, can that recovery be sustained or does he need repeated settings or something?
Madam, it all depends on the lifestyle of the patient, maintenance and quality of the life. For example, you have a tonsillitis. You recovered from tonsillitis, right? अब
Right.
जाके आप घर में जाके ठंडा पानी पी लो. What will you say?
Again, pain.
Yes?
So you will be giving some advice for the lifestyle.
Madam,
also,
advices are
because
common
he's done.
advice, not me. These are common advices for the disease. You don't know that in tonsillitis we do not drink cold water, we should avoid wind, we should avoid eating ice creams. But if you go, little recovery has come, and then you go and eat ice cream, you do repeated injury, you sit in the fan, you take cold water from the fridge, what will happen?
It will come back.
In most of the cases, you do the same thing what you do with the tonsil.
Okay. Okay, sir. Thank you.
See, whatever questions you are asking, the answer of your question is in your own questions. थोड़ा सा सोचिए, आपको जवाब मिल जाएगा. All the questions what you are asking, think silently. Every question has an answer. So you can answer your own questions if you think in a better way. I always tell the people, find your own answers. If you cannot find, always ask us. We'll also say, find your answers. Answers are easy. Only you make it complicated. People say brain surgery is difficult. I say, what will happen? Paralysis only will happen now. Okay, you bring it, I will recover. My neurosurgeon was saying, sir, if you remove this tumor, he will become paralytic by the upper limb and lower limb. What we will do, his life will become baseless. Who told you it will become baseless? Tell the patient to me, I will recover. You do your surgery, rest of the work is mine. Your work is not to recover the patient. Your work is to do brain surgery.
No.
Right? After that, your work is over. This is what Dr. IP Cherian says. My work is to do the brain surgery, not to recover the patient. Recovery comes in ICU. After ICU, the patient is forwarded to us, and it is our duty to resume him back to his original life. It may take time, but the patient can recover.
Hello, sir.
Please tell me.
Hello, sir.
I'm hearing you, Vishwas. Tell me.
Sir, my
Vishwas,
question.
tell me.
Sir, my question is, which meridian is also involved in sciatica pain, and how many types in sciatica pain? Can you
There
tell
are
me?
various types of sciatica pain. Generally, urinary bladder is involved, but in sciatica pain, we don't call it meridian-based treatment. It is called the sciatica nerve. If you go in TCM basis, sciatica nerve does not have a what? Sciatica nerve is not there. In any TCM method, nerves are not involved.
Okay.
They are called as a bi syndrome.
Okay, thanks, sir.
Right? When you are
Thanks,
using
sir.
meridian, nerve is not involved. But anyway, for your kind knowledge, GB syndrome, GB gallbladder and urinary bladder and kidney channels. These three channels are involved in sciatic nerve. Sometimes liver channel is also involved in sciatic nerve. The most
Spleen
common
channel,
affected nerve is
SP channel
perennial
is
nerve,
not involved.
femoral nerve, and common perennial nerve.
SP channel is not involved. SP meridian.
Spleen channel is generally not involved because it comes below the knee. Generally, the pain is near the calf region.
Thank you, sir.
In most of the cases, urinary bladder is involved. GB, there is a common perennial nerve, which is GB channel, and urinary bladder, which is just straight line to the below the knee, is involved.
Okay, sir.
So I think my knowledge is good enough to teach you.
Okay, sir.
See, I am teaching multiple people, multiple countries without even knowing what is your knowledge. But yet I am able to answer all your queries. I think my knowledge is better. I don't know from what, where, what question you will ask. Such a vast subject you may ask anywhere from the world. But thank God I am able to answer you.
Your level is far better than us. Very, very far.
See, one thing I tell you before I leave the class. Level, knowledge is ego. Love, wisdom, and sharing is what we must know. For example, I don't know how to drive car. That does make me inferior?
No.
So, my only question is that no one is superior, no one is inferior. I have learned little extra on this subject, so I know little more, but that does not make me superior to you. You may be good in one thing in which I am not good. So that does not make you superior, that does not make me inferior. In India, before I leave you this class, and there is a saying in India by a very good saint of Maharashtra, Sant Gyaneshwar, प्रेम की बोली बोल तू प्रेम ही परमात्मा कौन है बड़ा कौन है छोटा सब में एक ही आत्मा. Always speak in a good language, good conversation, because whatever resides is God inside you. He is neither big nor small. God is with the same shape. He resides in you with the soul. Respect everyone, have respect for everyone, love everyone, help everyone, and share whatever you have, so that when you die, this knowledge will stay here, but the people, service, and society will proceed again. I may take 1 or 2 days to gain the license of 300 people. Please cooperate. If anyone wants a refund of money, I am open to refund this money. I don't want to keep your money, which is of no use to me.
Okay, sir.
Right?
Thank you very much.
Good night, sir.
Good night.
Prakash ji ne mere ko my coordinator is saying me to leave the class. I have no option. मालिक का हुक्म आ गया. मालिक ने बोल दिया भाई क्लास बंद कीजिए.
Thank you so much.
Sir, thank you so much, sir. Thank you.
मालिक
Thank
ने
you.
बोल दिया क्लास बंद कीजिए तो करना
नहीं
पड़ेगा.
सर, मालिक तो आप है, हमारी तो
हम तो आपके नौकर है साहब, हम तो आपके दास हैं.
एक बात सुनिए, और जी हमारी मर्जी आपकी.
नहीं साहब, हम तो आपके चरणों के दास, आपकी चरणों की धूली लगाते हैं सर पे.
Good night, sir. Good night.
Good
Thank
night.
you, sir.
Kamal
Thank you
Bhai.
so much, sir. Good night. Good night.
Good night.
Good night.
Thank you, sir.
Good night.
Good night, sir. Good night.